It's a fun day here. We're at the Nursing Clinical Ladder Bloom Your Knowledge event. We're going to go check out some of the posters. The posters that are here today are totally awesome. Let's go hear from some of the presenters and learn what they had to learn about and what they're teaching us about making care better right here at Kettering Health Hamilton. Let's go. Let's first hear from Teresa Lynch, who works on the inpatient rehab unit at Kettering Health Hamilton. Let's hear about her project. Teresa, tell us about what you worked on.
Sure. My coworker Tasha Wilson and myself got together and decided that we had a need for education on documentation of bound bladder and the importance of what that relates to a rehab patient that's going to go home and how important it is to find out those things that are causing them to possibly be incontinent.
Okay.
And then we worked with our staff on education. We had a slow start because of the process of Epic and some things that needed to be upgraded. We took care of that, and once that education was provided, we saw an increase of 100% with our documentation, which also will result in better reimbursement as a rehab facility. So we can work with our patients and learn the barriers that will cause the incontinence and work with them in their therapy with occupational therapy and physical therapy to improve that for better outcomes when they go home.
Yeah, well, Teresa, it seemed like incontinence and those things would really get in the way of being able to participate in therapy, because inpatient rehab is all about getting patients better and getting them back to their daily living.
That's true.
So that's an excellent improvement in the. So great job.
Awesome.
Great work.
Thank you.
Well, hey, really fun time. You all both presented on the poster. So we've got Cristina Murphy and Tonya Phillips are here. Tell us about your poster. What did you all work on? What did you identify?
So we originally started our project on doing the trauma squad call report, and due to loss of our trauma program, we focused on stroke. We have a lot of new staff in our department. A lot are still in the residency program as well. So we really focused on how well our staff is identifying symptoms of a stroke, whether it's through EMS report or through triage. We found that there was actually quite a bit of area of improvement, especially for the identification symptoms that are maybe not as obvious. And we did some education with staff at Huddle, through a poster, and other just as they're coming in, talking through the report. Afterwards, we went through and did our data, and we've had as much as 40% increase in our output. So
that's awesome. So stroke is so critical to identify quickly and timely, and to see a 40% increase is really remarkable.
Yeah, absolutely.
Tonya, how about you? Because you work in a leadership role in the ER a lot of times.
So we really focused on the calls that we got from the EMS and patients coming from triage in real time.
Okay.
And we just kind of did one-on-one education with the nurses as they would bring the patients back. And it really did make a big difference in in identifying patients with strokes and getting them treated in a timely manner.
Well, that's excellent. So I love how this project really was focused on real time making a difference in the lives of patients. So as you started this, you might have been a little bit intimidated to start a big PIAT performance improvement project. What advice would you give to somebody who's thinking about embarking upon their clinical ladder? What advice would you give them?
No, I think that the biggest thing is where you really want to focus on with us being a stroke center. We had the recent change of TPA to TNK, so we really felt that was a good area for our nurses. So.
Well, excellent. Well, there you heard it. If you're thinking about it, if you're on the fence, talk to Tonya and Cristina. They are excellent resources. More importantly, they're making a difference in the lives of patients. Well, we're here with the poster for Alyssa, Carrie, and Abigail from the Kettering Health Hamilton ER. So tell us, Alyssa and Carrie, so Abigail actually worked late last night, so she gets a pass. She's getting a little bit of rest. But tell us about the poster project that you all did and what sort of improvement you all saw.
So we did ours on preparation of STEMI patients. We both are relatively new nurses, so within the last 3 years we became RNs in the department. We both worked as techs, and we realized that with the help of Jen Olds, our manager, that there's a great lack of education when it comes to preparing STEMI patients. Kettering's policy is that once an acute MI alert is set off, the Cath lab staff has a half hour to get to the unit in order for us to get them down there. So we did a pre and post test to see how much RNs actually knew about preparing. We actually found that there's a discrepancy between the STEMI narrator built into Epic and what the Kettering policy is.
Wow,
so,
good catch.
Overall, unfortunately, we didn't see like a drastic reduction in the time. 82% of the patients that we did have were ready for cath lab within 40 minutes instead of the 30, which is great. And 12% of them were not stable enough to actually go to cath lab.
Okay.
The increase in education is here. So the nursing staff actually greatly increased their knowledge of how to prepare cath lab patients. We're not really sure where the delay is, but we recommend creating kind of an annual education on STEMI preparation, continuously working with the cath lab to try to identify where those delays are. Maybe reaching out to the EPIC team to figure out why the STEMI narrator doesn't match the policy. And then we also would like to possibly improve EMS activation in the field to decrease this time to cath lab as well.
Well, it's really excellent that you all have seen a big improvement, because a lot of times it's just the knowledge of what to do and when to do it can make a huge difference. And so I know that the confidence in your team has increased. So great job with the increase in that. So if somebody's thinking about doing their clinical ladder project and they're maybe on the fence, what advice would you give them?
I would reach out to someone that's already done it. Shanita was our mentor for this project, and she answered so many questions and really made this project much easier than it would have been to take on our own.
How about you, Carrie?
Start early. So we started working on this before we actually did the pre-test. So we worked on it through the summer, and I think that helped us a lot, because when we were juggling multiple things trying to get this project done, it was much easier to do little bits than trying to cram it all in the last 3 months. So I think just working ahead and reaching out to your mentors is really, really important.
That is great advice. If you're thinking about your project, we got two pros right here. Abby who's working nights. Start early, start often, and talk to somebody who's done it before. Great job. Congratulations. Thank you all for the great work. All right, we're here with Sydney Cotton, Anthony Villegas. As I said that correct? All right, good. And then Molly Walden. Thank you so much. We're here learning about your project. Tell me about the project that you did and the poster.
So we chose this project because of when we were doing the survey with the ACHS people. And we had a huge opportunity for improvement on reassessment on pain medications that we were giving to our patients at the ICU. They just weren't being completed at all. We were doing an initial pain score, but then we weren't reassessing at all afterwards. So that's what this project was focused on, and we did this really to help improve patient outcomes and figure out if we're over-medicating or under-medicating our patients.
Because ICU delirium is a real thing, and we don't want that to occur. So what did you all find out as a result of doing the pain assessments?
So our initial was 29 out of 30 charts. We didn't have any charting for any reassessments. And after educating and doing more education with one-on-ones, with surveys, with PowerPoints, with all of that, our results were 66% were better.
That's a huge improvement.
That's awesome. To 66 is a big improvement. So, and our survey for results of answering our questions correctly of what is the correct thing to do was 100%.
That's excellent.
So people didn't know what to do, which is good, and we aren't over-treating or under-treating pain, and we're effectively sedating and making sure we have a correct interpretation of pain assessment.
So I'm curious, what impact did you see in the actual patient care? How did this impact the way patients receive care?
Well, it's important for us going in the surgical ICU, so a lot of patients are coming out of surgery and are in pain, a lot of craniotomy, so they're having big headaches. So if we're able to go in and give medication and then go back and ask them, hey, do you need more? Do we need to change things up? I think the patients were a lot more satisfied and had better pain control overall post-op.
So you saw a big impact at the bedside. You felt like patients felt better, more with it, less ICU delirium and other things going on?
Yeah, and it decreased drowsiness, which can be confused as a neuro change if they're too drowsy because of pain medication or if they're actually having something going on. So
that's really excellent. So what advice would you give to somebody who's thinking about doing a clinical ladder project? What advice would you give them?
I would just say to focus on something that would make an impact on your unit. Maybe just talk with your manager and collaborate. That's what we did, and I think it turned out well.
Excellent.
Like you said, we're in the surgical ICU, so pain is a real thing. So I think it's just important, if it matters to your case and if it matters to your unit, run with it.
I think just find a good group of people to do it with. I think it makes a big difference. So yeah, good support here.
Friends help.
Yeah, so have good friends. Get work. Identify something that's going to make an impact early on, and then work with your leadership team, and that's excellent. Well, congratulations! What a great improvement, and I know I'm sure it's made a big difference in the lives of patients. Congratulations!
Thank you.
Thanks for telling me.
Thank you.
So we're here to talk with some team in the ER. The Kettering Health Hamilton ER has got a huge number of posters, so make sure you check them out today. So Shanita and Mikaela, tell us about the project that you all did, the poster that you did, and what you learned and what you found out.
So our project was called Bridging the Gap, developing a better relationship between family birthplace and the ER.
Okay.
So we developed a pathway on how to guide the patient that presents in the ER, whether they're 20 weeks pregnant or less, or 20 weeks and higher. Do they stay with us for care, or do they go upstairs for a higher level of care for treatment?
Okay. Mikaela, what did you learn?
So that there was no kind of like a standard on where anyone needs to go. So we developed a flow sheet to decide where they need to go and who needs to be called.
Okay. How did you see that it impacted the way in which you all deliver care in the ER when people come in when women come in who are pregnant?
It kind of takes away the guessing game because it's a flow sheet. If you know what they're coming in for and that they're pregnant and how far along they are, you kind of just follow the pathway and it tells you where to do.
It allows for more continuity of care, essentially. So.
Well, that's excellent.
Yep.
So the team feels good about it. So the team, you did baseline audits of all of the charts.
Yeah, what we did we did patients that presented, how many total, and then what percentage stayed in the ER and went upstairs.
Okay.
So we didn't really have post data according to when we implemented the pathway. It'll go live next week because we've still been meeting and doing. So we'll know a better idea next week once we start implementing it.
That's perfect. I can't wait to hear how it goes and what you all learn, because that's part of learning is you always plan, do, check, act. And so we're in the process of acting, and we're going to start checking and see how things go.
Absolutely.
So what advice would you give to somebody who's thinking about doing their clinical ladder project?
Pick something that is of interest to you, has a special meaning. And if you're working with other departments, make sure everybody is on board and you all have the same common goal.
Okay. How about you, Mikaela?
Pick something that has easy measurable data. Not something that, like, there was not an easy way to measure this because we don't arrive everyone in the ER. So pick something that's easy to measure.
So there you have it. Pick something you're passionate about, something that other people are on board with, and something that you can get data for. Well done. Congratulations, Mikaela and Shanita. Proud of you all.
Thanks.
Here with the Kettering Health Hamilton ER team, Chloe, Joey, and Ellie. It sounds like a band. I don't know. It's some good names. Actually, they're a really cool group. So tell me about your poster that you all did. What'd you all choose?
We chose the soft waist belt restraint.
Okay.
We are doing this to prevent falls and promote safety in our ER.
Yeah, it also helps with a lot of our altered patients. Obviously, we don't just see confused elderly patients, so this kind of helps with our intoxication of some sort patients as well, which keeps us safe too. So we're not trying to catch people jumping out of bed.
So for those who don't know, what the heck is a gait belt? What does it do?
So it's basically almost like a seatbelt that goes around the waist that we quick release not to the bed. So kind of they still have function of their like limbs and stuff. So we're reducing injury on the wrists and ankles that sometimes we see because they're usually trying to move and try to get out. So it's basically a seatbelt.
Okay, that's cool. So what was the problem that you all came up with? How did you all identify this as the project you all chose?
So we've kind of been looking for an idea like this for a while, and we didn't really know in the ED that we had these. I guess we've had them in the hospital for years. And in the 6.5 years I've been here, and Joey's been here longer, we have not seen them used, so we decided to bring them down to the ED and teach our staff about them, because we do end up putting a lot of patients in restraints, unfortunately, but this is a much less invasive, less restrictive alternative.
Okay. So what did you learn as a result of implementing this?
Well, we're still kind of watching outcomes right now. This is kind of new for us, but so far so good. It's promoting safety. We're able to do this more often. We haven't stocked in our part room now, so we're still watching outcomes, but so far it's been so good, I feel like.
Yeah, we've been able to decrease violent restraints, which has been helpful, and limb restraints in general, which was our goal. So we've seen at least a 10% decrease, not increase, decrease.
What impact do you think it has on patient care?
I actually think the patients are more satisfied. I've talked with family members and they prefer this option to tying down grandma's wrists a lot more because they still have that freedom. And a lot of our confused patients don't even realize they have the seatbelt on.
Yeah.
So it's actually been, I think, an increase in patient satisfaction and family satisfaction as well.
But it still keeps the patient safe, but also you all safe as well. It's not trying to dive after the individual who's jackrabbiting or trying to get out of bed or doing stuff.
Exactly.
Well, what a great project. What advice would you give to somebody who's thinking about doing their first clinical ladder project? What advice would you give him or her?
Have a good mentor.
Okay.
Shanita was great.
Yes.
So have a good mentor. How about you, Chloe?
Also, just have a good team to work with.
Okay. It's who you work with. Good team.
I would say find something measurable, something you can implement and watch outcomes and watch numbers just to see if it's actually working.
Well, if you see Chloe, Joey, and Ellie, I just don't know why. It just sounds good to say it in that order. If you see them out in the ER, give them congratulations. Ask them how their project's going. Well done, you all. What a great project and what an impact it's going to have and is already having on patients. Proud of you all.
Thank you.
I'm here with Marcy Childs from Family Birthplace at Kettering Health, Hamilton. Marcy, tell me about your poster and what you learned.
Well, I did it on malignant hyperthermia.
That's a lot of big words. Wow.
Yeah, yes, it is.
So what is malignant hyperthermia?
It's a rare genetic disorder that when somebody's being put to sleep with a inhalation device in surgery, they can go into the syndrome called malignant hyperthermia. And if the nurses and the anesthesia person doesn't act very quickly, the person can die.
So they can get this from the medicines that they're getting.
Yes.
And then you have to identify it really quickly. How many patients have you seen in your time of being a nurse?
So far, knock on wood, I've never seen one.
Never seen any.
I'm sure the OR has seen some, but we do C-sections, and so most people in C-sections get epidurals. So we only occasionally have to do a general anesthetic. So luckily, I've never seen it so far.
Yeah.
But we started using this new medication called dantrolene. It's not new, but the formulation is different, and that's why I did the poster so that I could tell everyone about how we only have to drop one vial of medication instead of like 8 or 10.
Yeah.
And so it's a lot better now. And if we act fast, we get that cart and they stop the anesthesia and we give that medicine, and the patient has a much greater chance of survival.
Well, as in life, just like in the hospital, it's not what goes right, it's when things can go wrong. But really what you're doing here is really creating an educational awareness to make sure that if it does occur, knock on wood, it never does.
Yes.
We can quickly act and make sure that patients do not have any sort of adverse effect.
Yes.
So if somebody was thinking about doing their clinical ladder project, what advice would you give him or her?
I would say do it because you get education, you help your unit, and then you also get some money on the side too. So it's worth it. This is my 5th clinical ladder.
Okay, so you're a pro. So if you're looking for some advice, give Marcy a call. It's a lot of fun. Just do it. And more importantly, you get a few extra bucks. What else could you ask for? Marcy, thank you so much for telling me about your poster, and thank you more importantly for keeping our patients safe.
Thank you. Bye-bye.
So I'm here with more Kettering Health Hamilton team, Emily and Tiffany from the ICU. Congratulations on your poster.
Thank you.
So let's learn all about it. Tell me about your poster. What did y'all choose to do? What did you learn?
So we chose to do increasing knowledge and comfortability of ICU nurses using the level 1 rapid infuser for MTP.
So what is MTP for those who don't know, who don't work in the ICU, they don't know what MTP is. What is it, Emily?
So a massive transfusion protocol. So basically people need a large amount of blood products quickly.
Yeah, because that can make the difference between them either living or not living.
Exactly.
So what did you all work on the knowledge piece? What did you all learn on the front end, and then what did you do as a result of it?
Well, from the get-go, we realized that nobody was pretty much comfortable using this guy.
Yeah.
Because that's the level 1
That's a scary looking thing there.
Right. But I mean, honestly, it's not as bad as you would think. And so once we realized that people just weren't comfortable with it, I actually videoed Tiffany setting it up, priming it, getting it ready, and then we distributed that along with some MTP, just protocol information along to the staff, and it seemed it helped.
Yeah.
So what was their knowledge proficiency? Did you measure it beforehand?
Yeah, so we just did a survey pre-education of how, if they're able to, and how comfortable they are running MTP and the level 1 as 2 different things, because obviously you're working the machine is different from doing the whole protocol part of it. So the pre-survey was 36.4, and post they felt way more comfortable. We definitely had an improvement. With having the video, I think it's nicer to see more of it in action than like reading something.
So you used a video, but that's almost like 180% increase that you all saw. That's huge. Well done. So what advice would you give to somebody who's thinking about doing their first clinical ladder project? What advice would you give him or her, knowing what you know now?
pick something on your unit that you can see that needs improvement,
Okay.
that you feel passionate about, that
Yeah.
you're like, people can really benefit from
Yeah.
this.
That.
Ditto.
Honestly, ditto. Same. I mean, something that's going to be relevant. Just identify whatever that need might be, and just go for it.
So I love it. You all picked something that you saw that it was an opportunity, but you actually did something about it. So congratulations. Thank you for making the nursing profession better. And I'm really proud of the work that you all did. And what a great improvement to see almost 180% increase in knowledge. So just in the event if something happens, the team is ready and they're able to act quickly. Well done.
Absolutely. Thank you.
Thank you.
Here with Kelsey and Kim. The neat thing, we're going to learn about their poster here in a second, but the neat thing, which you all didn't see, was they actually were selected as one of the top 3 posters from all the 100, and I think it was over 40 people who presented. So you guys not only just doing an incredible poster, you all recognized as the top 3. Congratulations.
Thank you. Thank you.
So tell me about your poster. What'd y'all do it on and what'd you learn?
So we did it over placing CPAP infants skin to skin because at our hospital, no infants have been placed skin to skin prior while being on CPAP. And we saw through a prior coworker's ladder project that skin to skin is very beneficial. So we took that and actually implemented that with our infants that were on CPAP. So that way their parents were able to still hold them and bond with them during the time of them needing respiratory help. Sorry.
So for those of you who don't know, CPAP helps in this case a little one breathe. And it's an assistive device, but it can be rather scary. So Kim, what did you learn? How did this help the parents know what to do?
I think we showed a video to the staff to show them how to help place the infant skin to skin, and we also recommended having extra staff do that as well. We saw that moms were able to at least feel like they were participating in baby care, which was great. And it was an improvement, and it's great when staff also decided to help out and put babies, skin to skin.
So what results did you all see as a result of your poster that you did?
So we saw that we measured 2 things. We measured staff confidence in placing them skin to skin, which it went from being about 55% to 100%.
Wow.
And then placing the CPAP infant skin to skin, that increased from
0 to 33%.
Yeah, 0 to 33%.
That is huge. What a big turnaround. Because skin to skin makes such a big impact in both the infant, but also the parent.
Yes.
Well, what a great project.
Thank you.
So what advice would you give to somebody who's thinking about doing their clinical ladder for the first time? What advice would you give him or her?
Just go to your educator, your manager, your assistant manager, ask them what type of project, would be a good place to start if you've never done it. This was my first time doing a ladder project as well. So just ask them, see what, would be doable for you, start researching and, get in touch with Angela Huff. She's a great resource as well. And just use your peers.
Definitely do it. It's worth it. Definitely can improve patient outcomes and staff with knowledge, so it's good.
Well, I love how you all are giving back and helping to advance the profession of nursing. I'm raised by a nurse, and so I'm really proud of you all, and I know my mom would be proud of you all too, and all the other nurses out there. You all are making a huge difference. Congratulations. Thank you so much, and congratulations on being top 3 posters out of everybody.
Thank you so much. Thanks.
So here with Brad Morrison, Chief Nursing Officer at Kettering Health Hamilton. So Brad, we've just seen 10 amazing posters from our team at Kettering Health Hamilton. What do posters like this represent for the nursing profession?
I love the level of professionalism we see here. These are nurses who have committed to helping train, advance, educate, implement new process to make the care we provide better. So the fact that there's 140 posters in this room, Paul, is amazing.
It is amazing, and I love how the team is actually taking things and making the bedside the classroom. Because oftentimes we somehow think if I just can get through college, if I can get through university, I've then arrived. But the reality is we never stop learning, do we?
Nope.
So I love how you're fostering a culture of learning at Kettering Health Hamilton. I love how the learning is continuing and making a difference. Well done. If you're thinking about doing your poster, give Brad a call. We've got tons of great areas, and I know that more importantly, you see those areas in your workplace. So look forward to hearing about the ways in which you improve the workplace for better care, but more importantly, to make this a better place for the nursing profession as a whole. Congratulations. Great 10 projects, and so proud of the team.
Thank you.